Good morning, everyone. Welcome to today's press conference of Anti-Epidemic Command and Coordination Group. We have with us Chief Executive Mr. John Lee, Secretary for Health Professor Lo Chung Mao, Secretary for Innovation, Technology and Industry Professor Sun Dong, Deputy Secretary for Health Mr. Vincent Fong, Deputy Government Chief Information Officer Mr. Tony Wong. The Chief Executive will first speak, and then the other speakers will take turn to make some remarks. Chief Executive, good morning, everyone. When this term of government starts its work in July, on the 27th of July, we have, in order to fight the epidemic, established the Command and Coordination Group overseen by the Chief Executive. Today is our first press conference. I announce to you today, in relation to matters who arrive from overseas as well as Taiwan, and when they arrive at Hong Kong, their quarantine arrangements. The new arrangement will take effect this Friday, that is the 12th of August. The 7-day quarantine hotel arrangement will be changed to 3 days in a quarantine hotel plus 4 days of home medical surveillance. The 3 days plus 4 days arrangement will take the place of the 7-day quarantine at hotels. The medical surveillance of 4 days can take place either at home or hotels in general. For the 4 days of medical surveillance, the person involved can go out. However, they cannot enter places where there is active checking of vaccine passes. That is, bars, pubs, amusement game center, bathhouses, gyms, place of amusement, indoor place of public entertainment, party rooms, beauty parlors, clubhouse, night clubs, etc. And you can see a list on the PowerPoint presentation. They cannot enter premises where there is active checking of the vaccine pass. On top of that, they cannot enter elderly homes for people with disabilities, schools, and specified medical premises. They cannot participate in any activities where masks are to be taken off. And if they obtain daily RAT negative results, they can take public transportation to go to work, to enter shopping malls, emporia, or public markets. When they are under the 3 days plus 4 days arrangement, there is a PCR requirement. For those who are confirmed with COVID, they will be given a red code and they will not be allowed to leave the place of isolation. For those people who are not confirmed with COVID-19, they will be given a yellow code in order for the authorities to control their activities during the medical surveillance period. When the specified period of red or yellow code expires, the code will be changed automatically to blue. And these color codes will be displayed in the Leave Home Safe app. In relation to this new arrangement of 3 days plus 4 days, 3 plus 4, it is an important part of our work against the epidemic. And I would like to talk to you about the overall anti-epidemic policy of the Hong Kong SAR government. There are 5 points. First, we will not remain in a status of inaction. We will actively control the number of confirmed cases. We see that the number of admissions continue to climb in a proportionate manner. As a result, non-essential or non-emergency services of public hospitals will have to be reduced. That includes surgery, treatment for chronically ill patients. We have to, with precision, identify people of different level of risks in order to effectively control the scope as well as the number of people affected. The third point is that we have to strike a balance between risk level as well as our economic activity. Where risks could be controlled, we want to preserve maximum movement of people and to maintain Hong Kong's competitiveness. Fourth, we have to reduce the number of serious cases and the number of fatalities. Number 5, we have to protect those who are of high risk, who are vulnerable. That means those who are young, old, and chronically ill. Hong Kong is a city where people enjoy long lifespan. We have a very high percentage of elderly people. And 95% of the fatality cases are those above the age of 60. And close to 60% of those above the age of 80 have not completed 3 doses of vaccine. And the vaccination rate for those under the age of 12 is also low. Only 62% have received 2 doses. And those aged between 6 months and 3 years old have only started their vaccination program. So we will continue to vigorously promote the vaccination program. In relation to the basis of the 3+4 as well as details of the color health code, I will defer to the respective secretaries. First, I will defer to Professor Lo Chung Mao, Secretary for Health, to elaborate on the basis of the 3+4 arrangement. After that, Secretary for Innovation and Technology will give you information about the operation of the red and yellow health code. Afterwards, Mr. Chung will give you information about hotel bookings. Professor Lo. Thank you, Chief Executive. Red and yellow code and the amendment of quarantine arrangements for those arriving from overseas as well as Taiwan. This is to fight the epidemic with precision and to control risks. At the same time, this is to maintain our competitiveness. The Chief Executive has already given you information about the primary goal of the red and yellow code. This is to identify high-risk people. Red code identifies those who are confirmed with COVID. This is to ensure that they will abide by all the relevant requirements. For the yellow code, they are people who arrive from overseas as well as from Taiwan until they have completed their quarantine period. The Secretary for Innovation and Technology will give you details in that respect. For quarantine arrangements of those arriving from overseas as well as Taiwan, the Department of Health as well as the Health Bureau have been monitoring the number of imported cases. We've conducted analysis on the various aspects of imported cases, the timing of the identification of confirmation. We want to reduce the impact from quarantine on our economic activities as well as our connection with the world. We want to, with precision, control transmission in the community. There is a short incubation period of Omicron. Identification and onset of symptoms are quite early. So starting from August, we have added 2 days of PCR tests during the quarantine period in quarantine hotels. We have analyzed data over 4 weeks. We see that about 4% of those who arrived in Hong Kong are confirmed to be carriers of the virus. About half of the cases are picked up during the time when they're under test and hold at the airport A PCR test on the second day identified about 80% of those cases. Another way to look at the analysis, for every 1,000 arrivals from overseas and Taiwan, about 4%, that is 40 of the cases, are imported cases. With the PCR test and hold arrangement, we immediately identified and isolate 20 of these cases. Only 20 of these cases will go to quarantine hotels. The risk of people who become confirmed cases when they are in a quarantine hotel is reduced to 2%. We identified another 12 cases on the third day when these arrivals are at quarantine hotels. That means on the third day of quarantine, there are only 8 cases of the arrivals will turn out to be positive with COVID. That is only 0.8%. This risk level is comparable to the situation locally. The percentage of confirmed cases is actually lower than those under quarantine locally. 3 days in a quarantine hotel will identify 80% of the cases. We have reduced the risk to 1%. An additional 4 nights in a quarantine hotel, that means 7 nights in a quarantine hotel, is not cost effective, and it will also affect Hong Kong's connection with the world. That's why we come up with an amended arrangement. Arrivals from overseas and from Taiwan, if they obtain a negative result during test and hold, they are allowed to, upon application, replace quarantine in a designated hotel by home medical surveillance starting from the 4th day onwards. Apart from PCR requirements, the arrival is subject to a yellow code. They are not allowed to enter premises where there is active checking of vaccine passes. On top of that, they have to carry out a daily RAT as well as PCR tests at regular intervals. The arrival can carry on with their daily activities when they wear a mask. Say, for example, go to work, take public transportation, go to department stores, shopping malls, and go to public markets. We want to make sure that while controlling risks, we will take care of those who arrive in Hong Kong to ensure that they can still carry out their daily activities. In short, I will summarize the hotel quarantine arrangements as well as medical surveillance of those arriving from overseas and from Taiwan. For arrivals, they spend 3 nights in a quarantine hotel, and the morning of the 3rd day, there will be confirmation of a PCR test. When they receive the PCR negative result, starting from 9 o'clock, they can leave the quarantine hotel and spend 4 nights over medical surveillance, either at home or other places, until 9 o'clock on the 7th day. During that period, there will be a yellow code, and on the 7th day, the yellow code will be cancelled. We ask the arrivals to continue to monitor themselves for another 3 days. There may be a shortening of quarantine period at the hotel. We still exercise vigorous checking of arrivals. We require them to conduct a number of PCR tests at the airport, quarantine hotel, as well as during designated arrivals. That is, the 4th day, the 6th day, and the 9th day. On top of that, they have to carry out daily RAT till the 10th day. We will also streamline the procedure of quarantine. For arrivals, they have to complete the health declaration before they arrive. We will make sure that those who meet all the requirements of booking and declarations will receive a QR code. When they arrive at Hong Kong, there is no need to check relevant documentations. They will make use of this QR code to go through a fast channel to complete relevant checkings, and they will board a point-to-point transportation to go to the quarantine hotel. And they will receive information such as temporary vaccine passes and relevant passes. This will reduce the time that they have to spend at the airport. With a volatile situation in terms of the global epidemic, we will continue to exercise precision in the fight of our epidemic. We want to control risks and at the same time speed up our connection with the rest of the world and to take care of the needs of daily activities and our economic activities. I will now defer to the SIT.
Thank you, Chief Executive. Good morning, media friends and members of the public. In accordance with the latest anti-epidemic policy of the government, the ITIB has strengthened the functions of the Leap Home Safe app. With the latest updates that will come the red and yellow code, so as to ensure we can precisely control the risk pertained with certain groups of people. For inbound travelers from overseas and Taiwan arriving at Hong Kong through the Hong Kong airport, they will use the red and yellow code. For other members of the public, they can continue to use the Leap Home Safe app as normal. The new red and yellow code will not affect their mobility and the commuting. Now, concerning the red and yellow code, we require the updated Leap Home Safe app. The app will automatically update the status of the code to red or yellow according to the status. Upon completion of quarantine or medical surveillance, the code would automatically return to blue. Concerning the person in charge of premises, they have to ensure that they are equipped with the latest QR code scanner, which can identify red and yellow code. Now, Ms. Zhang, the Deputy Secretary of for ITI, and her team has prepared a video clip. Now I will show you the video clip. Lillian, I understand that the Leap Home Safe app is equipped with the red and yellow code to identify people with higher infection risk. Yes, Marcus, the red code only applies to people infected. They should be quarantined and isolated. For yellow code, it applies to inbound travelers arriving at the airport from overseas and Taiwan. They are allowed restricted activities in the community during the medical surveillance period. Users are required to update the version of Leap Home Safe to version 3.4. The app will update the QR code to red or yellow according to the status and return to blue upon completion of quarantine. Just press the setting and check the version of the app and update your app. And there is a support hotline 2626-3066. Feel free to call the hotline for inquiry. And also the EBT code verifier will be updated at the same time to assist law enforcers and premises owners to check the app. Now, most members of the public can use the blue code to enter designated premises without being affected. With the strengthened function of the Leap Home Safe app, we can fight the epidemic more precisely and assure the public. Now, I would like to emphasize that since the launching of Leap Home Safe in November 2020, we have recorded more than 8.4 million downloads. And we have received the support of 138,000 public and private premises. The Hong Kong public is very familiar with the usage of the Leap Home Safe app, and there is a habit to record your visits every day. Now, the functions and the designs of a Leap Home Safe app has strictly complied with the relevant privacy requirements under the law and the government's guidelines, and also security. And also, we have taken the views of public and private users. So I assure you that you can use the app safely. Now, I would invite Mr. Tony Wong, the deputy director, the deputy government chief information officer, to explain the usage of the red and yellow code. Thank you, Secretary. I would demonstrate the usage of the red and yellow code through a presentation. Now, as the video clip has shown, so those who are given a red or yellow code, they have to update the app. And also, you should update your app accordingly. It is very simple. Just press setting on the app and check the version of the app. The latest version should be 3.4.0. Just press check for updates, and the app would direct you to the App Store for an update. After updating the app, for those who are given a red or yellow code, the app would automatically compare your status with the database and change the color of your code. Now, this is an example. For a person under medical surveillance, under normal circumstances, say entering a premises requiring active checking, the app scanner would show a blue QR code, and the person would be allowed to enter the premises. However, if the person is under medical surveillance, the app would change the code's color to yellow, and a prompt would be given. If the person enters a premises under active checking, then the checker would review the yellow code, and the person would be denied access. For a red code, it is the same. If the person is infected, who has reported the infection status, then the system would compare the data in the database, and the QR code would turn red, and a notification would be sent to the person, notifying him that he is under home isolation. If he tries to enter a premises requiring active checking, then the scanner would turn red, and also a record would be made for follow-up actions. For a person under quarantine or under medical surveillance, after completion of the medical surveillance period, the next time he turns on the Leap Home Safe app, the system would automatically compare, retrieve data from the database, and the QR code would turn blue automatically without any actions by the users. And notification would be sent that quarantine is completed, and the person can go about normally. In terms of premises, later on, we will brief the premises under the active checking requirements. We will remind them to update the firmware of the QR code scanners. Now, if the leave home safe users is not connected to the internet, the QR code might be blue, but the updated QR code scanner can still show the red QR code status. So when the user turns on the internet function of their phone, the scanner will send a notification to the user's phone, reminding them that the QR code has turned red. So according to the requirements by the law, they should stay at home without going out. So that's all for my presentation. Thank you.
I will now defer to the Deputy Secretary for Health, Mr. Vincent Fong, to give you details about the new arrangements in relation to quarantine period at hotels. The Chief Executive as well as the two secretaries have given you information about other areas. I will now focus on arrangements in quarantine hotels. Under the new arrangement, inbound travelers in Hong Kong, the day when they arrive is day 0. And they will have to spend 3 days, that is day 1 to 3, at a quarantine hotel. At around noon on day 3, the person can complete the quarantine in a hotel and start the 4 days of medical surveillance. So you may refer to the PowerPoint details of Professor Low. For those who have booked 7 days at a quarantine hotel, there is no need to rush to change your booking. You can make use of your original booking documents to complete the formalities of a check-in for your flight. And around noon on day 3, when you have completed all the testing requirements, you are allowed to leave the hotel early. Most of the guests leaving quarantine hotels would check out in the morning. Hotels will have to deal with the checkout procedures in accordance with all the anti-epidemic requirements. So we ask guests checking out to be patient and wait for instructions from hotel staff members. For those who are currently staying in quarantine hotels, as per previous arrangements, we will ask them to complete all the tests. If they get negative results, they can, in an orderly manner by batches, leave the hotel. According to the agreement between the government and hotels, if there is a change in the quarantine hotel system, thereby resulting in a shortening of stay in these hotels, the amount that is not spent will have to be refunded to guests. With the change in arrangement, they may have to deal with tens of thousands of such applications for refund. So we ask guests to be patient while they wait for their refund. Now the floor is open for questions. I ask you to raise your hand. When you're named, please use the microphone we give you. Limit your number of questions to 2 and identify your media outlet before you ask your questions. First, the person on the right. Third row, the gentleman in white. I'm from Phoenix TV. We have every day, over 2 weeks, over 4,000 cases. Now you relax measures guarding against importation of imported cases. Does it mean that you have given up connection with the mainland? For the 4 days of medical surveillance, that means people can move about in the community. With a low vaccination of toddlers and babies, is it the case that you have disregarded their safety? And during the 4 days, these people can take public transport. Would you take the initiative to check whether they comply with the use of the scanning of the codes when they enter premises? When it comes to connection with the world and border reopening with the mainland, these are not two things that are conflicting or contradictory. We can still proceed what we're supposed to do. As I've explained, that the 3+4 days arrangement is to strike a balance between control of risks and to allow maximum freedom and in the community, and also to allow normal economic activities to take place. We're still trying our best in relation to the opening of borders with the mainland. We have to respect the anti-epidemic measures on the mainland. They have 7 days of quarantine hotel stay plus 3 days of medical surveillance. We understand that there are risk management requirements of the mainland. We hope that we will be able to reduce inconvenience to a minimum level. We endeavor to explain to mainland authorities about our position. We want to reduce the risk for the mainland. And when it comes to reducing inconvenience, we will do it step by step. We want to give them confidence that any measures to reduce the inconvenience are properly controlled. We have put forward various proposals before we reach a consensus. Before we reach that stage, I don't want to divulge any details, but we have a very close communication with the mainland. In our discussion, I give all the information available in relation to our anti-epidemic efforts to the mainland authorities. We want to reduce the inconvenience, and we aim to reach a consensus when it comes to a viable proposal. We do respect their strategy of 7+3 days. So connection with overseas countries and connection with the mainland are not two contradictory matters. I have spent quite some time at the beginning to give you information about our overall anti-epidemic strategies. It is to show that we're not in a state of inaction. We make use of scientific precision to identify different risk groups, and we want to protect vulnerable people, that is, those who are young, old, and those who are chronically ill. We also aim to reduce number of serious cases and fatalities. All our measures aim to achieve our goal. Our focus this time is the use of PCR tests. PCR tests gives us the confidence that we are able to, with precision, identify people with different risk levels. We'll continue with our effort to boost the vaccination rate. We ask you not to be complacent. 3 doses is the minimum. This will give us sufficient protection against any change of the epidemic situation. The number of cases may change. We keep in view these changes when we discuss about possible amendments of our initiatives. Under the new arrangements of 3+4, those with a yellow code are subject to restricted activities. We will enhance our law enforcement action and inspection. I believe that most people are willing to abide by the requirements under the 3+4 arrangement. We have minimized the level of requirement and give them maximum room for movement. Next, the lady with long hair. I'm from commercial radio. I have a number of questions. Now you use 3+4. Previously, it was said that you might use 5+2. Why 3+4? What's the basis? And for the 4 days of medical surveillance, how will people who arrive in Hong Kong be sent back to their home? Well, the restaurants will have to have their code verifier connected to the government database. But there is personal particulars in the vaccine pass. And if you do it this way, that means the Li Feng Safe Hub will be on the basis of real name registration, and that may impinge on personal privacy. What do you say to that? There are different speculations on our anti-epidemic strategies. I'm not going to comment on them. Every day, we consider all the facts and data available and make a decision on the most effective solution that will achieve our 5 goals. That is, to identify people of different risk levels with precision and to strike a balance between risk control and normal activities. The Secretary for Health has already said that in relation to the 3+4 arrangement, the risk involved is actually comparable to the risk in the community. So we have struck a balance between risk management and the resumption of normal activities. We think that this will serve the interests of Hong Kong. In relation to people who have completed the 3-day quarantine at a hotel, they can go back to their home under medical surveillance. As we've said, the person will get a yellow code. Every day, that person is required to do an RAT. If the result is negative, that person may take public transportation. So they can just go back to their own home by themselves. And if they don't have a home to go to, they can stay in other hotels to continue with their medical surveillance. We make use of the vaccine pass to operate the yellow and red code. As you know, that the vaccine passes are under real name. So we make use of the vaccine pass for the red code and yellow code. So it is in line with our existing practice.
Next question, please. The reporter at the back.
From the SCMP. So as the days of hotel quarantine have been reduced, what are the risks of having an upsurge of cases? And how will the government deal with the upsurge and additional pressure on the healthcare system? Will it contradict the government's goal of dynamic zero? And if the infected cases are under control, is there any room to further shorten the quarantine period later this year? And what is the internal assessment of if BA.5 really dominates in a few weeks' time? And as those people who receive the red and yellow code are allowed to go to work or school, will young students who are unvaccinated be exposed to higher infection risks? And how will the authorities contain the potential outbreaks at workplaces and schools? Thank you.
In our consideration of how long the duration of hotel quarantine should be, I have explained in detail the 5 considerations in the whole government's anti-epidemic measures. That is, we will control the best we can using different measures the number of infected cases so as to reduce the burden on our hospital services. We will be using scientific evidence and analysis of data so as to differentiate people into different risk groups. And accordingly, based on the risks, we design the measures of control. So those who are infected will have to remain at the isolation location, and those who are not infected will be given a yellow code so as to allow some social activities, provided that they do not take part in mask-off activities and the other conditions which I have mentioned. The main purpose is, while we can control the threat to public health, we want also to ensure that societies can have the maximum degree of economic and social activities so that society can go about as normal as possible and the competitiveness of Hong Kong can be maintained. It is a balance of factors. We have also a strong emphasis of protecting the high-risk group, the elderly and the very young, and also to reduce serious cases and to reduce death cases. It is a composite of factors that we take into consideration in designing what we consider to be the best measure for the overall interests of Hong Kong. Of course, we'll be monitoring the situation regularly so as to examine if there are any things that we need to do. But one direction which is clear is we will be making good use of PCR tests, which is reliable and also gives us confidence so as to identify risk groups depending on the development of the epidemic situation. But one message I want to tell is that I try my best not to roll back measures. That is why, in considering what measures that the government will take, I will be discussing with respective bureau heads so as to ensure that we have taken all the considerations regarding threats, regarding risk groups, regarding implications to society as a whole before we roll out the measure. And your question about students having a yellow code going into school, I must emphasize once again, this red and yellow code, particularly the yellow code, only applies to people coming from overseas and from Taiwan through Hong Kong airport after they have done the first 3 days of hotel quarantine, and provided they are not PCR positive, then they are given a yellow code. And so this is the key consideration when we assign the red and yellow code.
Next question, please. The lady in the front. Good morning. I'm from TVB. Now there are reports that the measures was to be announced last Friday, but there were some technical issues. That's why there is a delay. Is that true? So has the technical issues been resolved after the launching of the scheme? Do you worry that there will be more technical issues? And when will the database be updated? So with the red and yellow codes affects the commuting or mobility of people, and who can they approach if there is a problem? Now, concerning the checking out arrangements, there have to be some arrangements. If that's the case, why are the travelers allowed to take public transport to leave the hotel? Because the public transport would be more crowded than in the hotel. I think 2 questions are enough. Now, a question on behalf of the financial sector and the tourism sector. Do you think they say that the measures that would not help the recovery of their trade? What do you think? Concerning the different views and speculations, I will not comment on them. In terms of the 3+4 arrangements, we have made reference to the scientific data and also considered the practical operation of the arrangement. So today's announcements should be the one that you rely on. Concerning the hotel arrangements, I would invite the Secretary for Health and the Deputy Secretary to supplement. Now, before we decide to roll out any measures, the key concern is the efficacy in terms of controlling the epidemic and whether it is in line with the 5 key policies concerns I've mentioned. Having met all the 5 criteria, we would like to give the maximum room for daily activities and economic activities to the public. In the long run, we have to ensure that Hong Kong's competitiveness and economic activities can return to normal. So we will pay attention to the trend of the epidemic. So practically, I would try to avoid an across-the-board decision. Now, I would pay attention to the risk pertained with the epidemic and roll out measures regarding specified risk groups. So that is based on the data available and the situation then. Concerning the actual operation of the red and yellow code and the hotel arrangements, I would defer to the Health Bureau to answer. Now, the issuance of the red and yellow code would be simultaneous with the PCR test results. I would defer to the Secretary for Health and Mr. Fong to talk about the hotel.
The overall consideration is one of risk assessment. We analyze data to make a decision that within controllable risks, hotel stay between the 4th and the 7th day will be changed to home medical surveillance. As you've seen from the data, that 3 days stay in a hotel identifies 80% of the cases. Another 4 days stay in a hotel will achieve little. We think that the 4 days of home medical surveillance can still identify imported cases and stop them from entering the community. What I'd like to emphasize is that after 3 days of stay in a quarantine hotel, the risk of confirmation of COVID-19 is less than 1%. The current risk of confirmation of COVID is about 1% in the community. So arrivals carry a risk that is lower than someone who is staying in a community. So the arrivals can carry out their activities when they wear a mask. As we've said, that when they leave the hotel, and if you have a yellow code, they're allowed to go to work, take transportation. And what I'd like to say is that when you take public transport, you have to make sure that you wear your masks properly. So the risk they pose is actually a little bit lower than anyone in the community. Anything to add? To answer the reporter's question directly, well, the question of cross-infection in a hotel room. For quarantine hotels, the requirement, the anti-infection control requirements is higher than an ordinary hotel. There are people who deliver breakfasts, people who carry out PCR tests, and people who are checking in, and they all have different level of risks. We want to make sure that they will not cross paths and there will not be cross-infection. It takes time. That's why we ask guests to be patient when they check out because it may take longer. In relation to privacy concerns of the codes, when it comes to the name in the QR code of the vaccine pass, as well as the Leave Home Safe app, they may be sent to the government for verification. The information is actually stored in the mobile phone of the user, not in the government system. Last two questions of today. Any questions in English? One in the front to the left. I'm from
about a surge in cases after the shortening of hotel quarantine period. And can you explain why 3 days of hotel quarantine are required but not 2 or 1? And will this new arrangement affect chances of Hong Kong resuming quarantine-free travel with the mainland? Thank you.
I have explained that there are 5 considerations in the government's anti-epidemic measures. We will do our best to control the number of cases of infection. We will use scientific evidence and good analysis of data to differentiate people into different risk groups so that we can have accordingly use appropriate measures to control them. And we also have to balance the risk against the economic activities and the social lives of Hong Kong. We'll do our best to reduce serious cases and death cases, and we will place strong emphasis to protect people who are high risk, particularly the elderly and the very young, because the vaccination rates for them are still far from what we want. There will certainly be ups and downs in the number of infected cases. We will be monitoring that closely. But what is important is, while we will do our best to control the number of infected cases, we have to also look at the risk factors. What we have recommended now of 3 days quarantine in designated hotels is after examining the scientific evidence and the data, which gives us the indication that the risk factor of people having finished 3 days quarantine in designated hotel, the risk level is actually no more than the risk level of transmission in society, in districts. Based on this analysis, we considered that the risk is under control and balance it against the need for other activities to take place. This new measures of 3+4 will be in the best interest of Hong Kong. I must emphasize that during the 4 days of medical surveillance, there are also limitations on the activities. There are also PRC checks to ensure that we know whether there is any change of risk factors. They are restricted in the activities in those 4 days, and those restrictions have given us the confidence that the risk factor is equally controlled well, so that the new measures will not add to the risk of society as a whole in our control of the epidemic. Trying to connect with the world and making our travel with the mainland as convenient as possible are no contradictions. We have to work towards both measures. In other words, to make travel in and out of Hong Kong through airport as easy as possible, and at the same time make travel in and out of the mainland as easy as possible. We know that the mainland has their standard of 7+3, in other words, 7 days in designated hotels and 3 days for surveillance. We'll respect that. In our discussion with our counterparts in the mainland, we have to ensure that they feel confidence that any measures that we take will not create extra risk to their public health. Based on this mutual understanding, we want to find out methods so that we can reduce the degree of inconvenience in our traveling in and out of mainland. We are in close discussion with our counterparts, and we hope that we can reach some agreed measures so that we can announce. But I must emphasize that connecting with the mainland and connecting with the international world do not have any contradictions, and I am working on both sides so as to reduce the degree of inconvenience as much as possible.
Last question. The one on the right towards the back, the gentleman.
Good morning. I am from Cable News. So concerning red and yellow codes, the Secretary and some Executive Council members said that the yellow codes should be issued to close contacts as well. But it seems that you haven't announced that today. Is there any obstacles in terms of the tracing technology used? So would you expand the yellow code to close contacts? And second, about the 3+4 arrangement. So previously, the arrival date should be day 1, but now you are saying that it is day 0. So it is to align with the mainland's arrangement. Is that a decision after discussion with the mainland? So a lot of arrangements require the RAT, especially for yellow coat people. So how can you assure the accuracy of RAT and that the person has really done it? If someone enters a restaurant without doing a RAT, what will be the punishment? Now I will answer the questions first, and then I will invite the other secretaries to supplement. We don't have plan to extend the yellow coat to close contacts in Hong Kong. One reason is that the present red and yellow coat is based on the accurate PCR test. With PCR tests, we can accurately identify the risk of certain groups of people. In Hong Kong, for close contacts, we are not able to introduce a PCR test for them. So we don't have the statistic or the basis for us to make that decision to extend the yellow coat to local close contacts. Concerning the definition of day 0 or day 1, I would invite Secretary for Health to explain it. He will also talk about the operational details of testing. Professor Low. In terms of local people under quarantine or isolation, so when the first positive PCR test sample is available, that would be day 0. So medically speaking, we often call the incidence date day 0. So we are just aligning the definition in the arrangement. From a quarantine point of view, when a traveler arrives at Hong Kong, we cannot consider that he has completed 1 day of quarantine. Now, the present 3+4 arrangement requires a 3-day quarantine. So on the morning of the 3rd day, the traveler would be deemed to have completed the 3-day quarantine arrangement. So for most travelers, they will have to spend 72 hours in hotel quarantine. So it is definitely in line with the 3-day quarantine requirement. So we call the arrival date day 0 is definitely accurate. On RAT, that is a test done by oneself. So it requires individuals to perform the test themselves and report the result. I emphasize that a breach of the quarantine order is against the law. Upon a conviction, the maximum penalty is $25,000 in fine and 6 months imprisonment. So I urge inbound travelers to comply with our law. During the 4-day self-medical surveillance after the 3-day hotel quarantine, they should comply with all the conditions, including complying with all the restrictions under the yellow coat. They are not allowed to enter any premises requiring active checking of the Leave Home Safe vaccine pass, and they should perform RAT every day. And also on the 4th, 6th, 9th day, they have to undergo a PCR test. That is the requirement under Hong Kong's law, which must be complied by all inbound travelers. Otherwise, they will be subject to a maximum of $25,000 in fine and 6 months imprisonment. I would like to add that we do have the record or information about these people. We would know whether they have performed the test. If they are in breach of the requirements, we would take follow-up actions and find out the reasons. As the Secretary has mentioned, there are punishments for breaking the law. But I believe that most members of the public are willing to comply with the law. And the present arrangement has allowed for a lot of daily activities by these people on the yellow code. So if we have more safeguards, there will be more room for us to adopt more measures to make our anti-epidemic efforts more effective and return to normal life sooner. So after the announcements of the 3+4 arrangements today, we will deploy more manpower at the airports because we believe that after the 3+4 arrangements is put in place, more people will come and go from Hong Kong to and from Hong Kong via the airport. In terms of checking and law enforcement, we will also step up our efforts to ensure that the risk is controlled. Those who should be put under restriction are indeed under restriction. And for those who are in breach of the restrictions, we will take actions. Lastly, under our overall anti-epidemic policies, please understand that we brought measures on the basis of controllable risk. Under the 3+4 arrangement, from our analysis shows that the risk is in line, if not lower than the risk pertain to our daily activities. So we would, under the principle to achieve the maximum relaxation and safeguard, the 3+4 arrangements risk is not higher than what we already have in society. Under the principle of controllable risk, we want to resume economic activities and normal daily and social activities. Thank you very much. That's the end for the press conference of the Anti-Epidemic Command and Coordination Group today. Thank you very much.
好，加埋呢個。
黃碼嗰啲高峰
Those with a yellow code cannot enter premises with vulnerable groups. That includes hospitals and care homes. These are high-risk premises. In relation to going to work or going to schools, currently we allow that as long as they wear the mask properly and they don't engage in mask activities. That's allowed. Thank you.